Well, good evening. I'm Jean Robillard. I'm the Vice President for Medical Affairs and Dean of the Carver College of Medicine. And I'm delighted to welcome you tonight to celebrate the achievement of the class of 2017. We are especially excited that this is our first commencement ceremony held in our new Hancher facility. And I think you will agree this is a beautiful facility, but more important, it is a fitting location for this monumental occasion. The graduate in the audience this evening represents students from 4 distinct Carver College of Medicine programs. Tonight, students will receive their master's degree in medical education, the Doctor of Medicine degree, or their combined Doctor of Medicine and Master of Public Health degree, or the Doctor of Medicine and Doctor of Philosophy degree. To all the graduates, to all of you, the Carver College of Medicine joins your family and friends in sharing the excitement and pride of your accomplishment. Now I would like to introduce my colleagues who will be part of tonight's celebration. On your far right are Dr. Christopher Cooper, Senior Associate Dean for Medical Education and Professor and Vice Chairman of the Department of Urology. Dr. Cooper. Dr. Nancy Rosenthal, Assistant Dean for Medical Education at Wake Forest School of Medicine in North Carolina. Dr. Rosenthal will give the commencement speaker later tonight. Next is Dr. Christy Ferguson, Director of the Master Medical Education Program and Professor of Internal Medicine. Dr. Ferguson. And Dr. Steve Lentz, Director of the Medical Scientist Training Program and Professor of Internal Medicine. On this side are some special guests. First, Mr. Ken Cates, Chief Executive Officer of the University of Iowa Hospital and Clinic and Associate Vice President for UI Healthcare. Next, it's my pleasure to introduce Dr. George Vista Wayne, President of the Iowa Medical Society. In this role, Dr. Vista Wayne served as a critical advocate for healthcare excellence across the state of Iowa. She is also a practicing child and adolescent psychiatrist at Mercy Pediatric Neurology and Psychiatry Center in Des Moines. Dr. Finally, I would like to introduce Dr. Pat Winokur, Executive Dean of the Carver College of Medicine and Professor of Internal Medicine. In addition to serving as a guiding light for the college regarding our key missions in education, research, and clinical services, Dr. Winokur is also a nationally known scientific investigator and runs an active clinical research program focused on infectious disease. Dr. Winokur. It is now my honor to turn the podium over to Dr. Chris Cooper.
Good evening. What a happy day this is, and what a beautiful day it was today. And this place is phenomenal. It really is incredibly nice, and I think you guys deserve to graduate in a place like this. I wonder if they use it for anything else. You should have seen the place actually in the past. None of you graduated before, but as far as I know. But let's just say the convention centers in Chicago and Las Vegas have nothing to worry about as far as losing business to the Coralville Marriott Convention Center. So every year I come out on stage and I welcome you and your loved ones and supporters to commencement. And except for about 1 or 2 people clapping and saying yay, everyone else just sort of sits there like they're preparing for a root canal. Then I've got to spend several minutes reminding the students that tonight is literally a night that one of their long-held dreams comes true. And I've got to remind the parents that their children are finally getting a real job. I also remind everyone in the audience that tonight is the night we're putting into society a force for good. I then usually contrast that to what's happening at the law school graduation. Which, in my active imagination, is held in some dark and undisclosed location, and you can hear coyotes and wolves howling in the background. But tonight, I'm not going to do that. I'm not going to do it for 4 reasons. First, the lawyers threatened me. Not with legal action, no. They said they would hire United Airlines security to give me their special doctor treatment. So, the second reason, we are truly in this phenomenal hall, which is befitting of your achievement. I'm not sure I've ever said befitting before, but I thought I'd try it out tonight. The third reason, I've just got this feeling that the students in this class are waiting to erupt with jubilation. And finally, I've got the same feeling about this audience. I believe you are all just waiting to show these students how excited you are about their graduation and their future. So with all that said, here goes. Good evening and welcome to graduation for the medical school class of 2017. Can't stand up. That was awesome. I'm very impressed. I learned tonight, actually, that Miles Greenwald, who's graduating tonight, his father and grandfather are here, and they both graduated from this medical school. And I'm betting that round of applause surpassed the rounds that they had. So I'm very proud of you guys. I'm also very relieved because the first thing they taught me in dean school was never turn your back on the students. So I was bracing myself for champagne corks hitting the back of my head, so that didn't happen. I know this is a happy night, but goodbyes are always bittersweet for me. Tonight is perhaps even more so than usual. Tonight we bid farewell to Damian Ehrig, who has served as our registrar and the man behind the curtain for the last 9 commencements. He was even nominated by this class as a graduation speaker, but that was before they knew he was about to perform the ultimate mic drop and side exit on all of us. Damian, where are you? We know you're here. It was his last day. Step out here, Damian.
Your remarks there.
So, I want you to consider this your going away party.
Oh.
I don't have a gift, but I do have a half-empty bag of Doritos that we will give to you.
Thank you.
Damian, you've done a terrific job. The students obviously think so much of you. Thank you.
Thanks, Chris. Appreciate it.
So on the bright side, Kelly here is our translator for the hearing impaired, and she is Damian Ehrig's cousin. And she's agreed to stay with us as long as we do not go back to the Corville Convention Center. So, Kelly has been through more commencements than anyone here. So I like to keep her on her metatarsals. That means balls of your feet, Kelly. I just wanted to see what you'd say for metatarsals. So, if she gets bored, she tells the viewers at home to get a snack or change the channel. So, we've got to keep her engaged. Tonight, we also bid farewell to Jean Robillard, who has high hopes that a replacement dean will be found prior to next May. And I suspect he was hoping it'd be found prior to about 7:15 tonight. So, This is actually the second time I've bid farewell to Dean Robillard at graduation, and he promises there will not be a third. So tonight, I'm excited to welcome back Nancy Rosenthal, but I'm disappointed that she's just here for the evening. And finally, tonight, I bid farewell to all of you. You know, with all these people leaving, it's starting to give me the feeling that they all know something that I don't. So let me take a couple of minutes now and introduce you to the class and brag to you about them as a class. They've been terrific, and I truly am so proud of them. They are a very special class. They are the last group to complete part of the old curriculum. As they know, the class that follows them were the first group to go through the entirely new curriculum. And you all know that class has the reputation for being very laid back and relaxed. I do really appreciate your help in trying to calm their nerves, and honestly, I appreciate the support you have provided me as well. That class is going to continue to follow your lead, and they too will graduate here next year. And at this point, we anticipate about 24. So don't tell them that. They won't find it funny. No sense of humor. So in my 11 years, in my final year, as Associate Dean for the students, I've never had a better class. And I know that sounds very presidential these days, but it's actually true. This group is really incredible. They've been so generous in giving of their time and efforts outside of class. They're noted to be a cohesive group that truly gets along and works well with each other and with others. I must also say, when I watched the slideshow that this group put together at Match and saw all of their extracurricular activities, I was impressed by all that they had done, but I was also impressed how handsome and beautiful this group was. It's like they had some inherent knowledge of group modeling, and that's something we didn't teach you guys. You just came by it naturally, I guess. Anyway, we're going to miss your aesthetics around the college. It's going to be a slightly uglier place without you. So. You all might think that I'm biased because I like this class, but let's look objectively at what they've done. They're very bright, as you'd expect, and they've outscored the national average on the board scores. In addition, this class has taken on a lot of extracurricular work, and in fact, a third of the students will graduate tonight with added distinction. These students have done sustained extracurricular work and projects in areas such as research, service, teaching, humanities, global health, and the healthcare delivery science and management track, which members of this class actually developed. A majority of our students have also done work in one or more of these areas, even if they didn't complete a distinction track. In addition, we have students graduating from the rural medicine program, 2 from the MD MPH program, and we'll have 6 getting their MD and PhD tonight. We also have the first student ever in Bechi to get a Master of Fine Arts while also pursuing an MD. Now they're getting into it. I like it. This class has also been involved in reaching out and getting involved in various activities that help their fellow students, the college, the local community, as well as the national and international community. They have not only cared for themselves, but their actions have also demonstrated their care and compassion and desire to serve the broader communities, both near and far. Some of these medical students have hiked the Himalayas to serve some of the most remote communities in the world. They've worked in teams to address emerging infectious diseases such as Zika in Brazil. They've addressed concerns such as cancer in Uganda. They've participated in care for women stigmatized by obstetric fistulas in Niger. They've assisted children with clubfoot challenges in Peru. They've worked on cleft palate challenges in Guatemala. They've also worked with domestic communities facing barriers to care, including migrant workers in Iowa and the Indian Health Service patients across the nation. Some of these students even went to the Iowa State Fair. And it was a presidential year. So brave. I'm very excited that a large percentage of these fine physicians will be staying in Iowa for their residency, and I hope we can convince them and those that are leaving us to come back and practice medicine here and care for us. Of the 136 graduates tonight, 49 are entering primary care, which includes family medicine, internal medicine, obstetrics and gynecology, and pediatrics. I could go on and on about your accomplishments, and you all have much to be proud of. But, you must humbly recognize that you did not get here on your own. From birth, you have been given gifts of intellect, curiosity, and stamina. And it is through the support of many people, including family and friends, some of which are here tonight, your schools, your teachers, through all levels, elementary through college, your faculty, and others that you're graduating tonight. You are so fortunate to be able to be going into such rewarding careers where you can serve and help others. So as you sit here tonight, I want you to be both proud of your accomplishments, but thankful as well. And as people congratulate you later this evening, remember to thank them for their support and the opportunities that they have given you over the years. I want to take just a couple of more minutes of your time and attention to give you a few parting thoughts. Being a physician is an honorable and noble profession, but it is not an easy one. It requires a commitment to lifelong learning. After tonight, you will have fewer faculty involved in your lifelong learning, but you will have many more teachers. You can and you should learn from your patients and their families. They need to become your teachers, and you need to let them. It truly took me too long to learn this lesson. You have an amazing opportunity to learn from so many people. You can become very wise. I believe you can learn from anyone at any time. Don't be afraid to ask questions or to say, I don't know. Even though you're graduating tonight, we certainly didn't teach you everything. The practice of medicine is changing rapidly. You're going to face changing and challenging times, and this can be stressful. I cannot predict what it's going to be like for you or even for me in several years. But one thing I do know is that there will be people who need you and trust you to care for them. And as long as you can establish a one-on-one relationship with these people that you serve, you're going to have a truly rewarding career. My take-home message for you tonight is to recognize the support, talents, and responsibility you've been given so that you can make a difference in the field of medicine and in the lives of so many. It is a great responsibility, but I have no doubt it is one you will not shirk, and you will continue to make all of us proud. You've been a terrific class, so don't get me wrong when I say I'm glad that tonight I stopped becoming your medical student dean, because tonight you join me and the rest of the clinical faculty as fellow physician colleagues. It has been my great pleasure to serve as your dean of students, and you have my sincerest congratulations. It's my pleasure now to introduce Ms. Molly Thompson, a fourth-year medical student from Rockwell City, Iowa. Since matriculating into our college 4 years ago, Molly has been an active participant in an array of student activities and organizations, including serving this year as the Carver College of Medicine Student Government President. Molly will have the honor of introducing tonight's commencement speaker, Ms. Molly Thompson.
Dr. Nancy Rosenthal was born and raised in Philadelphia. She attended medical school at the University of Pennsylvania and continued her residency training at the University Hospitals of Cleveland, Case Western University in anatomic and clinical pathology. She also completed a fellowship in hematopathology. Her first faculty job was at the University Hospitals of Cleveland in hematopathology. In 1998, she accepted a position at the University of Iowa. In 2000, she became director of hematopathology and served as the vice chair for education in the pathology department. She became assistant dean for student affairs in 2011. Dr. Rosenthal has received many honors during her tenure at Iowa, including the Frank A. Mitros Excellent in Teaching and Clinical Service Award in 2014. Last year, Dr. Rosenthal accepted a position as a staff hematopathologist and the assistant dean at Wake Forest in Winston-Salem, North Carolina. The University of Iowa and Carver College of Medicine was so sad to see Dr. Rosenthal go that the class of 2017 invited her back to be our keynote speaker. So please join me in welcoming back to Iowa our Dr. Nancy Rosenthal.
Thanks, Molly, for that lovely introduction. Deans Robillard, Cooper, Winokur, Drs. Lentz, Ferguson, Vista Wayne, Mr. Cates, faculty, graduating students, friends, and family. Thank you so very much for inviting me to be the graduation speaker this evening. It's so lovely, as Dr. Cooper said, to be in Hancher after so many years at the Marriott. This is an amazing venue, and it certainly adds to how special this evening is, although this is a pretty spectacular evening no matter what the venue. For both the students and their families, this is the culmination of many years of hard work and dedication. My guess is that the graduates are incredibly excited and a bit terrified, but you should really savor the moment. You made it. You're a doctor with all the privileges and responsibilities that that title bestows upon you, and you should be very, very proud of your accomplishments. As the students know, and as many of the audience might not have known, I was a faculty member at the Carver College of Medicine for many years and an assistant dean for most of the time these students were here. In October, I moved to Wake Forest University, and as the students also know, this was not what I had envisioned for the last part of my career. But as a part of a dual career couple, I needed to leave when my husband became chairman of medicine at Wake Forest, and although I did think for a bit about commuting, I figured October was a time to leave if I had to go, as I should get out of Iowa before the weather turned nasty. It's good that graduation is in May after the nice weather has returned. I'm thrilled to be able to give this talk and impart a few words of wisdom to this class as they become our newest physicians and go on to the next exciting phase of their careers. When I first started thinking about what I wanted to say, I thought back on the many graduation speeches I have heard over the years, and I realized I might be at a distinct disadvantage. Many of these talks have been about incredible patients and families and how they have impacted the speakers' lives as they practice medicine. I still remember part of the graduation speech that I heard when I graduated many years ago. The speaker talked about putting a patient in a bathtub filled with warm water, which can be both diagnostic and therapeutic for kidney stones. This was a very long time ago, probably more than 60 years. With fewer easily available imaging techniques, when physicians were more likely to rely on interview and physical examination skills, as well as the occasional immersion. Describing interactions with patients can be incredibly inspiring and life-affirming, and are worth talking about to students who will soon embark on the next phase of their medical career. Here's my problem. I'm a pathologist, specifically a hematopathologist, and my interactions with patients are via microscopic slides with small tissue biopsies which I evaluate. While these specimens can be extremely interesting, you don't get a lot of feedback from them. And while I do realize that what I do is extremely important for the patient, the rewarding aspect of patient contact is largely absent from my practice. I was then left with the quandary of what I was going to talk about. So I went, as many do these days, to the internet and Googled excellent medical graduation speeches. Not to plagiarize, that would not be professional, but to get some inspiration. When you do this, you find an amazing array of incredibly accomplished people who have given commencement address at medical schools over the years. Ex-US presidents, actors, the Surgeon General, etc. Incredibly erudite and inspiring talks, and reading them only served to raise my anxiety level. How could I possibly measure up compared to these extremely worldly individuals? So then I decided I needed to speak from the heart. The advantage I have in talking to you is that I've gotten to know all of you very well over the past 4 years, and hopefully I can impart some personal touches into this speech that would not be possible from someone coming from the outside. First of all, I want to say how lucky and blessed I have been to enjoy what I do, come to work each day ready for the challenge to do the best job that I can do for each patient, and teach in a way that is meaningful for each student. My wish for all of you is that you find your career as rewarding as I have, and that you have sustained interest in your chosen specialty over a lifetime. I also encourage you to think about including education as part of your career. To me, nothing has been as satisfying as seeing students learn and understand as they progress through their medical school years. Seeing those aha moments as you start putting things together, going from learning lots of facts to understanding patients and their diseases, and then how to help them, is priceless. But there are a couple things I specifically want to talk about, as I've been thinking about them excuse me, a great deal lately. One of them is burnout, which has been in the news recently, but first I wanted to talk about how we as physicians treat each other. If I had $1 for every time someone told me that I'm pretty normal for a pathologist, I could have retired long ago. I know that people mean this as a compliment, but to me, it just sounds disparaging of my chosen profession. And it seems to me that we also encounter derogatory comments regarding other physicians more often than we should. A recent op-ed piece in the New York Times by Perry Class, who's both a pediatrician and a writer, addressed this issue. She was writing about rudeness encountered by physicians on the medical wards from both patients and colleagues. She quoted from a 2015 study called Sticks and Stones that said 31% of doctors were subjected to dismissive or aggressive communications, and this occurs several times a week. Reasons for this are similar to those that relate to burnout: increased workload, lack of support, and a hierarchical culture. We need to continue to strive to create a culture of respect in medicine. We need leadership to set expectations within institutions that don't allow this kind of behavior to continue. But little things also matter. As you step to the next rung of the medical hierarchy, maybe you should just think about who you want to treat those on a lower rung than you, specifically medical students. Treat them how you want to be treated. Remember how it felt not to know your place when rounding with the team or being part of a case in the operating room. I know you'll be incredibly busy, but just take a minute to stop, explain what's going on, and answer a question from them. And then when it comes to dealing with physicians who are practicing other specialties, ones that are involved in an aspect of medicine that you consider less than desirable, treat them with the respect they deserve and don't disparage them. My guess is that you have sometimes heard negative things about other physicians on the wards and in the clinics. My hope is that all of you here can break this cycle. Have respect for all types of physicians, actually all members of the healthcare team, as each brings their own expertise to the table, and this can only be beneficial to patient care. We all hear things about how medicine is changing and how additional challenges are encountered on a daily basis. The electronic medical record, too much paperwork, tight clinic schedules, etc. And while I do think these things are absolutely real, I was thinking about some of the tasks that I had to do when I was a medical student and house officer back in ancient times. We didn't have computers, so we had to transcribe lab results from the lab slips into the medical records. We did our own gram stains, streaked culture plates, and even did our own sedimentation rates. You drew the blood, you took a tube and you put the blood in it, you taped it to the wall, and then you set a timer, because there was no cell phones to set a timer on at that time, and you hoped you remembered to come back in an hour and see how far the red cells had fallen. We also drew blood, started IVs, and in some cases, wheeled patients down for an X-ray. So times have certainly changed, and even though most of those tasks have been transitioned to other providers, which has freed up some time, other tasks have multiplied and are equally, if not more, time-consuming. I'm well aware of the increasing pressures that are felt by physicians, residents, and practicing physicians. Burnout is an issue which has been shown to impact 75% of physicians in training and half of practicing physicians. This may be due to the increased complexities of the healthcare system. Increased burnout has been attributed to loss of control and autonomy, increased burden of documentation, pressures to shorten length of stay, and decreased time for interacting with patients. I am, however, cautiously optimistic that help is on the way to decrease the incidence of burnout. This school, as well as many others, has implemented wellness and resiliency initiatives to help students and physicians cope. In addition, there is increasing attention being paid to this issue on a national level. A recent article published in Health Affairs details an action plan that arose from a group of CEOs of 10 leading healthcare delivery organizations who are part of a summit meeting at the American Medical Association headquarters to address this issue. From this meeting, there was a call to action to support team-based models to optimize physician utility, urge national organizations to share best practice, and to work to decrease government regulation, among other things. I urge each of you to be proactive and try to change the culture that has developed. As you go along in your career, work with your coworkers and staff to try to change things on a local level. Join and become active in your specialty society so the voice of physicians can be heard and listened to. You might even want to get involved in politics to induce change on a national level. But what can individual physicians strive to do to combat burnout? As I was preparing for this talk, I came upon an editorial by Ronald Epstein in the Journal of General Internal Medicine. He was commenting on an article in the journal regarding factors that motivate physicians and markers of physician well-being. In the commentary, he brought up the concept of eudaimonia. This term was new to me and may be new to many of you. I always feel like I need to teach you something, and hopefully you'll remember this longer than you did the coagulation cascade. While this term was new to me, it's a very old concept. Eudaimonia was Aristotle's term for human flourishing. Eudaimonia comes from within. It is practical wisdom that comes from a good indwelling spirit or good genius, a sense of deep engagement that reflects your deepest values, that you treat others with compassion and kindness, but also employ positive actions toward yourself. He encourages physicians to think about what they find most meaningful in their work. Rather than complaining about what's wrong, maybe think about what better might look like and how it would feel. He encourages physicians not just to think about these things by themselves, but to have discussions with their colleagues. Epstein mentions that in his practice, he spends the first few minutes of each office visit as a computer-free zone, which allows him to better connect with his patient. So as you progress in your career, I urge you to periodically revisit why you went into medicine in the first place and strive to find meaning in your work. You should think about how to employ techniques in your practice that allow you to get back to why you started this journey in the first place, to help people because you care deeply about their well-being. Reflecting back over my career and thinking about the journey that you are about to embark on, I'm still incredibly optimistic about what lies ahead for all of you. There are changes all the time, new things to adapt to, and new things to learn, and it's never boring. I've never regretted my decision to become a physician, despite my mother's warning that I couldn't be a physician and have a fulfilling life. She was a stay-at-home mom, and she wanted me to be the same. There are many times it wasn't easy, but it was always rewarding. And when my daughter expressed an interest in becoming a physician, I didn't hesitate in encouraging her to follow her dream. I'm proud to say that she's just finishing her first year as a medical student, and if all goes well, she will be the 4th generation physician in our family. One of the most special things about this career is you really don't know what opportunities will come your way or what paths lie ahead. If anyone had told me as I was starting out in this business that I would have an administrative role working with medical students, I would have been extremely skeptical. But 5 or so years ago, when the opportunity presented itself to apply for an assistant dean position, I applied thinking most likely someone with more experience would get the job. Surprisingly, I was picked, and now I had to learn a great deal about student affairs and curriculum, subjects I was certainly not taught in medical school. I must have done an okay job, as when I left Iowa, it took 2 people to replace me, and I'm standing here giving your graduation speech. My point is, we never know where our medical careers are headed. New and exciting opportunities often present themselves, and you should go for it. Get out of your comfort zone. It's been an amazing experience watching all of you grow and expand your medical horizons over the past 4 years. From the time you were sitting around the table in 1119th Murph in your black or gray suits on your interview day, scared to death but smiling like crazy as I explained the Iowa curriculum and the extracurriculars available here, to when you showed up on day 1 eager to get started on your journey. How you learned to assimilate large blocks of material, bounced back from the difficult 3rd biochemistry test, got through a long 2nd year when you were ready to be on the wards, and then survived step 2. Transitioning to the clinic brought its new challenges and excitement, including longer hours and figuring out how to learn in a different way than you had ever been exposed to in the past. Having to think on your feet, present your patients in front of a team of physicians with much more experience than you, and how to fit in so that you can be helpful but not get in the way. The members of this class had the special challenge of welcoming the 2nd-year students on the wards, which made it more crowded. But what did you do? Became mentors for those more inexperienced learners, which benefited both you and them. You all figured out what part of medicine interested you most, chose a specialty, traveled all around the country doing interview, black and gray suits again, matched, and came to this day more mature, more confident, and ready to begin residency. I know that you are well prepared for whatever you want to do. I am confident you will go out and be good stewards for the University of Iowa. Even if you don't think so and are scared of what lies ahead, I have utmost confidence in all of you and know that you are ready for the challenges ahead. It has been my extreme pleasure working with you, and I am proud of each and every one of you. Thank you.
We would like to present Dr. Rosenthal with this engraved clock.
Good evening. The 6 Masters in Medical Education students receiving their degrees tonight bring the total number of MME graduates to 40, representing 14 different departments and programs. Examples of projects developed by these students include a 2-week elective in patient safety, a simulation exercise to teach learners how to perform a kidney biopsy, and an ultrasound coloring book. A key component of the MME program is practicing the lifelong learning skill of reflection. Most do not enter the program with this practice on their list of favorite things to do, and nearly all leave with great appreciation for its importance. They now join a community of educators who will engage in reflective practice throughout their careers.
Will the candidates for the Master in Medical Education please stand? Dean Robillard, these candidates have completed all the requirements for the degree of Master in Medical Education, are recommended to you by the faculty of the Carver College of Medicine for the conferring of this degree.
On the recommendation of the faculty of the Carver College of Medicine and by the authority vested in me by the Board of Regents, the state of Iowa, I confer on you the Master in Medical Education degree as qualified and designated. Will the candidate please come forward to receive your diploma? I think we go over there.
Biling Armijo. Dr. Eric Epping. Dr. Emily Folks. Okay. Dr. Bharat Kumar. Billy Rudin. Dr. Melissa Swee.
Will the candidates for the Doctor of Medicine degree please stand? Dr. Robillard, these candidates have completed all the requirements for the degree of Doctor of Medicine, are recommended to you by the faculty of the Carver College of Medicine for the conferring of this degree.
On the recommendation of the faculty of the Carver College of Medicine and by the authority vested in me by the Board of Regents, state of Iowa, I confer on each of you the degree of Doctor of Medicine as qualified and designated.
You just became doctors, all right? That was it.
Candidates, go ahead and sit. Please be seated.
Dean Robillard, on behalf of the faculty and administration of the Carver College of Medicine, I present to you these graduates, these doctors, who have just been awarded the degree Doctor of Medicine. They will now be presented with their doctoral hoods and diplomas. The shell of the hood matches the black material of the gown and is lined with the old gold color of the University of Iowa. The velvet border of the hood is indicative of medicine, which is traditionally represented by the color green. Dr. Rosenthal will join me in the presentation of the hoods. Graduates, will you please come forward to receive your hoods and diplomas? Tonight. Come this way. You know what they did? We're gonna line them up. It's our first time in a new building. We'll get the kinks worked out next year, so. All right. Dr. Richard Amendola. We're going to make you work for it, Nancy. Those clocks aren't free. Dr. Timothy Hondo. All right. Dr. Raja Lakshmi Arunachalam. I've been working on it. Dr. Reed Bartholomew. Dr. Mitchell Beckert. Dr. Anthony Berger. Dr. John Bergen. Dr. Zachary Bergman. Dr. Mark Bevel. Dr. Riley Boland. Dr. Ezekiel Brown. Dr. Nathaniel Camden. Dr. Samuel Carlson. Dr. Justin Chang. Dr. Constance Chen. Dr. Cole Cheney. Dr. Stacy Chu. Dr. Madeline Cross. Dr. Christopher Sykosh. Dr. Christopher DeBoer. Dr. David Damick. Wait a second. Dr. Amira Dumick. Dr. Amanda Deutsch. Dr. Sarah Dooley. Dr. Michael Dunlay. Dr. Mbechi Erondu. Dr. Gregory Esparza. Dr. Jacob Evans. Dr. Jonathan Fagg. Dr. Aaron Fairbanks. Dr. Fisher. Dr. Jane Fisher. Dr. Megan Flannery. Dr. Blake Funky. Dr. Derek Gartner. Dr. Samantha Gilg. Dr. Colette Gennady. Is that good? Yeah. Dr. Lindsay Goad. Dr. Madeline Godar. Dr. Laney Gitchie. Dr. Austin Greco. Dr. Miles Greenwald. Dr. Jade Grimm. Dr. Brian Gitchow. Dr. Shannon Hammer. Dr. Taylor Hercock. Dr. Kevin Wang. Congratulations, Alex. Dr. Alex Hoover. I offered. Dr. Elizabeth Hoover. Dr. Shelby Hopp. Dr. Andrew Hornick. Dr. Chun Sing Wong. Dr. Timothy Hurst. Dr. Christopher Iverson. Dr. Stephanie Ivins. Dr. Arvinder Jandu. Congratulations. Dr. David Janacek. Dr. Lauren Javernick. Dr. Michael Jorgensen. Dr. Shay Jorgensen. Dr. Alyssa Kaufman. Dr. Cameron Koch. Dr. Jacob Kolker. Dr. Brent Kramer. Dr. Manisha Kumar. Dr. Ryan Lay. Dr. Swan Lee. Dr. Susan Leslie. Dr. Chase Libo. Dr. Daniel Locker. Dr. Ricardo Lozano. Dr. Brandon Lyle. Dr. Daniel Ma. Dr. Uche Maduka. Dr. Emily Malling. Dr. Benjamin Matthews. Dr. Matthew Maves. Dr. Michael McHugh. Dr. Scott Meester. Good. Dr. Jose Mercado. Dr. Marielle Maurice. Good. Dr. Ian Mitchell. Dr. Joseph Nowak. Dr. Tyler Olson. Dr. Brian Park. Dr. Drew Park. Dr. Charles Paul. I wanted to say Charlie. Dr. David Peters. Dr. Kevin Pettit. Dr. John Pienta. Dr. Scott Pierce. Dr. Mitchell Pitlick. Dr. Benjamin Quarshie. There we go. Dr. Mark Ramirez. Dr. Laura Rausch. Dr. Tyler Ronfelt. Dr. Frederick Ruckersfelt. Dr. Catherine Reichen. Dr. Omid Salami. Dr. John Salcido. Dr. Alexandra Schefter. Dr. Kristen Seligman. Dr. Kirk Seide. Dr. Stephen Slade. Dr. Ann Smazel. Dr. Garrett Spencer. Dr. Joseph Sumley. Dr. Mushet Sirkan Nicolau. Dr. Christopher Tam. Dr. Rachel Tinna. Dr. Molly Thompson. Dr. Deanna Thorson. Dr. Alexander Tomesh. Dr. Johnny Tran. Dr. Jonathan Vonk. Dr. Samuel Wagner. Dr. Avery Whitus. Dr. Alexander Wickenkamp. Dr. Noah Williford. Dr. Jessica Wolfel. Congratulations, man. Dr. Terrence Wong. Dr. Kevin Robleski. Dr. Eric Yates. Dr. Jeffrey Zavala.
We have a few more very important ones. Will the candidates for the combined degrees, Doctor of Medicine and Master of Public Health, and Doctor of Medicine and Doctor of Philosophy, please stand? Dean Robillard, these candidates, having completed all the requirements for the combined degrees, Doctor of Medicine and Master of Public Health, or Doctor of Medicine and Doctor of Philosophy, are recommended to you by the faculty of the Graduate College for the conferring of these degrees.
On the recommendation of the faculty of the Graduate College and by the authority vested in me by the Board of Regents, State of Iowa, I confer on each of you the degree Master of Public Health or Doctor of Philosophy as qualified and designated.
Graduates, will you please come forward to receive your 2 hoods and diplomas? The combined MD, PhD graduates will be joined by their faculty mentor, who will simultaneously present them with their graduate hood. Dr. Amr Al-Bokal. Dr. Stephanie Frana. Dr. Amanda Benavides. You first. Dr. Sean Gu. Dr. Jenna McCracken. Dr. Jung-Min Park. Dr. Viral Shaw. Dr. Amanda Swanton.
I will now like to address the Doctor of Medicine as you have come upon a decisive moment in your development as physician. You are about to recite the physician oath. While you took a very similar oath at your white coat ceremony a few years ago, and as you have honored that promise, the next few moments will set you apart from your medical school career. This oath is a symbol of your commitment to the healing arts and is acknowledgement of your solemn duty to perform at the best of your ability. I ask you to think very seriously about what the oath means, especially the importance it signifies to those whom you treat. As you commit to each paragraph, concentrate on the meaning of your vow and how you must see it through. Thus, acknowledging the magnitude of this ceremony, I now ask the Doctor of Medicine graduate to please rise and turn to page 9 of your program. I would also like to invite Stephen Slade, our student recipient of the 2017 Leonard to Humanism in Medicine Award, to come forward and to read the physician oath.
Class, please join me. I do solemnly swear by that which I hold most sacred, that I will be loyal to the profession of medicine and just as generous to its members, that I will lead my life and practice my art in uprightness and honor, that into whatsoever house I shall enter, it shall be for the good of the sick, to the utmost of my power, I, holding myself aloof from wrong, from corruption, and from temptation of others to vice, that I will exercise my art solely for the cure of my patients, and will give no drug, perform no operation for a criminal purpose, even if solicited, and far less suggest such a thing. That whatsoever I shall see or hear of the lives of others, which is not fitting to be spoken, I will keep inviolably secret. These things I do promise, and in proportion as I am faithful to this, my oath, may happiness and good repute be ever mine, the opposite if I shall be forsworn. Please be seated.
Well, congratulations. I think our state and nation are extremely fortunate to receive such bright, talented, and compassionate physician, researcher, educator, and healthcare provider. Just raise up, guys. Well, before we adjourn, I would like to take a moment, however, to acknowledge an important cohort. And commencement are also a time for us to express gratitude and appreciation to the parent, spouses, family members, and friends of tonight's graduates. You have helped make this journey possible with your love, support, and encouragement. We recognize that this is also a celebration for you as well. Also, I would like to recognize and extend my appreciation to our wonderful faculty members, many of whom are joining us here tonight to celebrate our new graduates. Thank you for your dedication and support over the last 4 years as you helped guide and nurture this outstanding class of graduates. Now, following this ceremony, my colleague and I will be in the lobby where we will look forward to congratulate you personally. I wish you the very best as you embark on your future endeavor. And to formally conclude, I ask the graduates to please stand, and I ask the audience again to join me in concluding this proceeding by saluting you with another round of applause.
you.
I was about to zip off to the other side.
My funeral, sorry about that. Best of luck to you. I appreciate it. Thank you.
Thank you.